I thought I would start a bit about, how public health fits into the road traffic collision area, what we have in common in terms of our work in this sector. I also thought I would talk a little bit about the past, where we've come from, where we are today, and a few encouraging things for the future. And I think the speakers this morning, Mayor and Deputy Minister, has touched on the amount of work and the volume of activity that is going on in this area, and then give you a bit of an overview of what's going on in Vision Zero in Canada, really building a momentum. And this is a journey while road safety has been going on for a long time. Vision Zero is really a bit of a new endeavor, even though it is embracing a lot of activities that we have been doing for a long time. So who is Parachute? Some of you know who we are. Some of you have been on the journey of how Parachute was formed. But we are Canada's leading national charity dedicated to preventable injuries. And that is a real key focus for ours, not only in the road safety space, but also in topics like concussion in seniors, health and seniors falls. And you would think that these are very disparate topics, but in fact, they overlap a great deal. When you talk about those that have suffered a concussion, driving motor vehicles, seniors' independence, and their ability to get around and their mobility, not necessarily in motor vehicles, but using public transit, we find these threads are throughout the work that we do. And when you look at our vision, a Canada free of serious injury, it really, when we started to learn about the Vision Zero framework, it really matched the philosophy of our organization, that we aren't going to prevent all injuries, but we certainly want to prevent those that are serious and life-changing. And that speaks to the second part of our vision, which is Canadians living long lives to the fullest. That really is the ultimate goal of the work that Parachute does and the work that each and every one of you in this room does. We want to prevent people from experiencing serious or life-altering injuries so that they can continue to do the things that they love in life and live long lives to the fullest. So our focus really is on an upstream approach, and I'm going to talk a little bit about that. But interesting what Mayor Nancy said is we need action. We need to know what is evidence-based, what is good. In terms of applicability, we need to know that there really is action at the end of the day. And so one of the things that we want to fill is this implementation gap that we see. And this is a quote from one of my colleagues in knowledge translation, Dr. Melanie Barwick, talking about a real loss of momentum when we don't have the implementation of good science, of good data, of good evidence, that we miss out on those research benefits. It costs us money. If there are dollars going into research to find out what is the most effective, and those effective interventions aren't actually implemented, all of us lose. And so we really have to be cognizant, and where Parachute spends a lot of our time and effort is on that implementation and working to get research into action. So many of you have probably seen this. This is from Sudbury District Public Health Unit. I'll give them the citation. But I really like this visual to really explain about what prevention is aiming to do. So you can see an individual going in on the upstream, probably jumped off that rock into the stream. And there are those downstream trying to save them. And if they need medical care, you can see that there is health care available. Our efforts, and a lot of the efforts of those of you in the room, is in that upstream area, making sure that things don't happen to begin with. And measuring the absence of something is sometimes very difficult. We often think about the downstream costs in terms of healthcare costs, but there's also costs to those individuals in their journey from upstream to downstream. Their families that have experienced mental health issues from the experience of being injured and going to hospital or not going home at all. This is an impact that goes beyond the individual, their families, and into communities. And so I wanted to talk to you about a good practice model that we use. And you will likely see very much a similarity for the work that you are doing, and you will see yourself, I expect, in some of these processes. So this is the traditional public health approach, where we start with defining the problem. What do we want to address to begin with? We have to understand what the issue is before we can even start to envision what the potential best practice and interventions may be. We want to know the risk factors. Who is at risk? Why are they getting hurt? Where are they getting hurt? And what are some potential protective factors? We want to select an intervention that actually works, and where a lot of parachutes activities happen is in the implementation of programs or policies or education. And then making sure that we evaluate what we are doing to make sure that we've actually made the impact that we want. There isn't unintended impacts that we don't want to happen, or unintended impacts that we didn't expect but actually are a positive thing. If you've worked in this road safety area at all for any length of time, you'll know that just having the evidence or data isn't enough. That there's context and environmental factors that really impact on the work that all of us do. And we have to understand what those look like. What are the perceptions of the people that we are trying to reach? Do they have the same concerns that we do based on the evidence and the data that we're seeing in terms of who's at risk? And those perceptions are as important as what we know to be true from the data, because those are the real life, the everyday living that the people that we want to impact, that we want to bring into the fold and have them come along on the journey to inform the work that we do. What are some of the political climate that you're working in? Has the government just been elected, or are they on a re-election cycle? All of these matter, including the resources that the community has that you're working with. And you'll see a theme throughout my talk around stakeholder engagement, about really getting all of the different perspectives to the table. And so the model that we use actually builds on all of those components, really is a comprehensive approach as to how we do the work that we do in road safety and Vision Zero, but all of the other work as well. So we've been at this a long time. I am a little bit of a history buff, so you'll see a couple sprinkles throughout this presentation. But this is actually the first person who was fined for speeding in the United Kingdom. So poor Walter Arnold in 1896 was fined $1 for traveling 8 miles an hour in a 2 mile an hour area. So we've been at this a long time. We've been ever since the first automobile interacted with the horse and carriage and pedestrians and cyclists. So I did look back into some public health documents, and this is a CDC, Centers for Disease Control, weekly report. And this is looking at the span of time, 100 years, 1900 to 1999. And you can see from the title that they are looking at road safety, motor vehicle safety as an achievement in public health, a 20th century public health achievement. So why do they say this? So this is the rest of the article. It's looking at, over time, the number of vehicles, miles traveled, which you can see is on the increase exponentially. And over the time from 1925 to 1995, a 90% decrease in the deaths on roads. So we don't do a very good job of celebrating our successes, generally speaking. And even though we know that there's a lot more to do, we have come a long way. So how much is good enough? When do we know that? So I took a look at an issue that I think we can all relate to in terms of road safety around seatbelt use. We know that seatbelt use started extremely low and has grown. We're in the mid-90% range right now. So this is looking at the cumulative estimated number of lives saved by seatbelt use. And I know that some of us are feeling a little frustrated that things aren't moving along as fast as they could be in Vision Zero, or that we have to cross all the T's and dot all of the I's to make sure that that Vision Zero is actually being implemented properly. So I thought if we had run into the same thing with seatbelt use. It was a long, hard battle to get people to put seatbelts on every time they got in the car and to drive. So if we had stopped there, when you look at the number of lives saved, all of these, or maybe most of these lives would not have been saved had we stopped our efforts. And so while it may be difficult, it is something that we need to continue to do. And I think the marrying of transportation safety between transport and public health and a myriad of other sectors that I will touch on as we go forward is really important. And I'm calling on one of our stakeholders to give us an example of that.
I'm Matt Amar. I'm with Peel Region Public Health, and Peel Region has recently adopted Vision Zero, and the Health Department and the Transportation Department are working really, really hard on implementing the plan for 2019. We're really excited about what's going on. Firstly, I want to say Vision Zero, road safety itself is really not just a transportation issue, it's a public health issue, a public health problem, but public health cannot solve this alone. We certainly need to work in partnerships, and it's been so critical to be at the table with our transportation colleagues. And I encourage every municipality that's really keen or interested in doing this work, really start to have those conversations with all those key stakeholders. Talk to your police departments, talk to your public works departments, really talk to your transit agencies, the advocacy organizations on the ground with cycling and pedestrian groups that are really passionate. I think the more robust your partnership is, the better your plan will be. The other important piece is good quality data. One of the things that we're doing right now within public health is actually reviewing all the hospitalization trends for motor vehicle collision injuries. We're working with our transportation colleagues to analyze police collision data to understand the trends when it comes to serious injuries and fatalities. This information will help us to prioritize our work on Vision Zero.
So we can stop now, I think, is the message, because we know that there's still too many Canadians being injured or seriously killed. We know it's costing way too much for society in terms of numbers, but also in the human toll. And unfortunately, those under 14 are still the leading it's still the leading cause of death. So how are we going to achieve our goals? One of the key things is talking about the language that we use. And accident is something that those of us in injury prevention have been trying to eliminate for many, many, many years. But in particular, our focus over the last couple of years is around the language of accident with Vision Zero. And you can see here an example of a public awareness campaign that ran in a number of major cities last summer and into the early fall, and will run again, trying to share the information that words matter. When you call it an accident, it sounds like, or the connotation is that it can't be prevented, when in fact these are all predictable and preventable. So we are fighting a battle, and as I looked through the program for the next couple of days, I was struck by a number of the language in some of the titles: conflict, plight, countermeasures, curb, consequences, combat, challenges. Tidal wave, I like that one a lot, because everybody has a right to come home. I think we all agree on that. And I was encouraged because there was as many positive terms or phrases that were used in the titles for the program. My favorite, moving out of departmental silos. But building a vision, collaborative effort, working together, pent-up desire, which I think is fantastic. There's a couple more. Effective implementation and implementing Vision Zero, making it happen. So there's a lot of positivity. I think there's a lot of effort that we have to do. And when we look at even the frameworks and approaches that we have, complete streets, towards Vision Zero, safe systems approach, and Vision Zero networks. So talking about that aspect of collaboration and that we are going to get there faster together. So the language really makes a difference. I think it really helps when we talk about the fact that we are not trying to prevent all injuries, but people being killed fatally or serious injury on our road transportation system, that goal of Vision Zero. So when we talk a little bit about language, this is taken from one of many media coverage of a road traffic collision. They don't talk about the human aspect of it. That car did not travel 40 miles or 40 kilometers an hour over the speed limit alone. There was a driver with a foot on the pedal doing that. And that oncoming vehicle had individuals and potentially pets and other valuables in that. So we need to communicate for impact. And I was struck by some language that Surrey, who is on the Vision Zero pathway, used in turning language from those injured in collisions to victims of harm. And you can see by the change of phrase and the change of language, it really does change the meaning, and it pulls the attention away from the vehicle or the bicycle to the actual individual who is impacted by this. So we know we have a lot of obstacles, and I'll run through these relatively quickly. But really, Vision Zero is a bit of in a beginning. We have had not a lot of time in terms of, if you think about the initial slide I showed from 1896, we've been at this a long time. But Vision Zero is relatively new, and although we want it to happen fast, we don't need to give up, even though we've had some obstacles at the beginning. So some of the obstacles are, as you can imagine, time and money. So these we are always short on. But even if you have a lot of money, sometimes time is still the biggest enemy. I know in talking to colleagues from Toronto's Vision Zero, that even though they had an influx of dollars and funding for the Vision Zero activities, just the time to get contracts in place or purchase materials and services resulted in what the public saw as an actual delay in the implementation of Vision Zero, when it was actually simply a factor of the system that they were working in. So we have to be prepared to defend some tough decisions. We heard Tony talked about the difference between Vision Zero and the traditional road safety approaches. And so these are some of the obstacles and some of the challenges that we're coming up against. But I think that the passion and the driving force of those working in this area can really put some of the passion into those decisions and turn minds towards Vision Zero, the true concepts. So there's a lot of different perspectives. I touched on this already, and these are only a few of them, and they all need to be taken into account. So one of our other colleagues from Manitoba Public Insurance, next slide, is going to demonstrate that.
Hi, I'm Curtis Wenberg. I'm the Chief Operating Officer for Manitoba Public Insurance and the co-chair of the Provincial Road Safety Committee here in Manitoba. There's a couple of tips that I'd like to give you as you're starting your Vision Zero or Road to Zero plan, as we call it here. One of them is it's great to have diversity on the group that's working on this. So we have in the Road Safety Committee here in Manitoba representation from the infrastructure group, enforcement, health, justice, and then us with licensing and insurance. And it really helps with the broad perspective and can break down silos maybe around things like data and who owns data around collisions and injury, or potentially even controversial projects and various stakeholders involved. Second tip I'd give you is that these are long-term trends. Serious injuries can be variable from year to year. So make sure you stick with it, give yourself some long-term targets, and most important thing is to get started. Good luck to you.
So as you can see, there's lots of competing priorities, not only within the different perspectives that we have, but we want to move people quickly and safely. And so we need some time to figure that out, and in some cases, there are very different perspectives in terms of how we achieve that. I think we've heard a lot about this already today, that this is a long-term strategy. There are some quick wins, as we've heard, and I know we're going to see some in Calgary. Hopefully you'll be able to get out and take a look at those Churchill curves. But, you know, there are quick wins, but this is a long game. This is something that is going to take some time. So Megan is another one of our colleagues that we asked to comment on exactly that.
Hi, I'm Megan Lichty, public health nurse from Southwestern Public Health. I've been working towards Vision Zero in our area for the past 2 years. Some key suggestions I would have would be to build relationships with as many of the key partners that you can from the beginning. So that would include your county public works departments, your local police and enforcement agencies, and your local cycling or active transportation committees. And I also think it's really important to engage with local residents to get that message out. That will really help to get the political will and political support that you'll need to advance the strategy in the future. And I also like to get the message out about the vision itself. I think some people get really stuck on the number 0, and you'll get feedback that it's an unachievable goal and people don't want to commit to it. So I really like to enforce that this is a vision, something we're working towards, and try not to get stuck on the ultimate number of 0. And it also helps to frame your messages to the different audiences that you're dealing with. It's a long process. I would say keep going. A year and a half ago, I think I was the only person in Oxford County, which is a rural area of about 100,000 people, that even talked about this. And now I have a stakeholder committee and a road safety committee with all of our local agencies committed to this. So there is hope. Keep going and just keep talking.
And I think what Megan pointed out was something that we turn our attention to. We talk a lot about Calgary and Edmonton and Vancouver, but Vision Zero really has applicability in rural areas. And certainly when we look at the Ontario experience, actually the majority of our fatal and serious injuries happen outside of urban areas. So not losing track of the fact that Vision Zero applies to all areas, all communities. Access to data is really important, and I know there's a number of you in the room today that really love data, and I love what it tells me more than I love actually manipulating the data, but really adopting that data-driven approach. And this quote from the City of Toronto, and certainly Edmonton and Calgary, we've seen these locations really focusing and making the data drive their decisions and make the priorities based on what they're seeing in terms of where the biggest burden is. So we need to build on solutions. Next slide. And I think it's important, again, this theme throughout, I think you'll understand that we want to focus on that collaboration. It means everyone, whether you're sanding the streets, designing streetlights, or painting the lines, whether you're a community group, a parent association at a school, whether you're the policymaker or the elected official making the decision, all of us have a role to play. And speaking of citizens, engaging the people that we really want to be impacted. They want a safer environment. They want to be able to ride their bicycles. They want to be able to walk and take transit and drive, whichever mode of transportation makes the most sense to them. And we want to get more people out and walking. And so we want to understand what the groups of stakeholders, what those community groups are experiencing. Mayor Nenshi was a perfect description of really understanding the real life, real world experiences of the people using our roadways, and so that we can incorporate their perspectives and their knowledge, their really valuable knowledge that goes along with the evidence and the data. The other point I'd like to make is that there are other sectors that might not initially jump to mind as collaborators or supporters. And one of the things we did at one of our Vision Zero summits is bring together those people working for physical activity, for the environment, chronic disease prevention, because we are all driving towards some similar goals and wanted to have a conversation about how do we leverage these activities? How do we understand in terms of timing what would actually help our cause and align us with activities going on in other areas, and what actually might be detrimental and we may want to revise the timing? But look around your communities and see whether there are champions in places where you may not have thought of before. So what's going on in Vision Zero in Canada? This is a great example of what Surrey has done in terms of their stakeholder consultation and the development of their plan for Vision Zero. And I'm sure you'll hear more about that in the conference in the days to come. This is Vision Zero, now 1.0. Toronto is going to be releasing their 2.0 plan very shortly, but you can see that their approach to data-driven collaboration and incorporating that experience of others with these vulnerable populations has formed the plan for that city. And of course, Vision Zero in Edmonton, Mayor Nenshi talked about the 5 E's, and there they are. And you can see some of the successes that Edmonton has had. These are just a few, not to leave out any community that is doing Vision Zero, but just to give you a sense of what's happening across the country: Montreal, Vancouver, London. The region of Peel is very interesting because that is a region made up of 3 cities. And so we're interested to see how Vision Zero rolls out in that kind of framework. And of course, those of us working at the national level are key to setting the stage, to making sure that there is national connectivity and the evidence is being brought forward. And so these are just, again, some of the folks that are working on Vision Zero. So Parachute, we really wanted to respond to the stakeholder needs, and that is what created Vision Zero in the first place for us. It was a demand for knowledge about what is Vision Zero, how do I do this? And in the last probably year and a half, we've heard more questions about how do I know I'm doing it correctly? And so we want to be responsive to those stakeholder needs, and this landing shot from our website is where we try to do that, where we want to pull together the best evidence, the best reports and data that we have out there, and connect that with the people who are really wanting to implement this and doing this at a local level. We will be releasing a white paper in the fall that will pull this information together and make some recommendations and really give some concrete direction to communities who are thinking about Vision Zero or who are just starting Vision Zero. And as I was reviewing our latest post, one of the quotes from Shabnan in Surrey struck a chord, and I wanted to end my keynote on this as you go forward to the conference, to think about the ebbs and flows of your work, the challenges and the opportunities. CARSP, I think this program covers all aspects of this, but really this quote comes down, I think boils it down for all of us and why we're actually doing the work that we do in Vision Zero and road safety. It takes a lot of commitment and passion. We have to have the knowledge that the work being done is being done to save lives. I think that's why we're all here. And it's not just a grand statement, it is a true mission. And with those words, I hope you go on to explore the next 3 days of the program and the Vision Zero workshop after that, and I wish you a very good conference.